friends, welcome back to my channel Learn with Sri. Happy New Year to everyone. Okay, let us move to our topic. Yes guys, so far we have covered topics of hematology and today we are moving on to something different. That's helminthology, study of helminths. I plan to do like an image based study. I feel it's easy to understand, This visual learning is very powerful. It will give better memory retention. So, today let us move on our topics. Okay, what are helminths? Helminths are parasitic worms. Then what are parasites? What is parasitology? Parasitology is the study of parasites. What is parasite? A parasite is an organism that lives on or in a host organism and get its food from host. Wow, very nice. Also, these parasites are classified into three main classes. They are protozoa, helminths and ectoparasites. So, today we plan to discuss about helminths. These helminths are also classified into three types according to their morphology and structure. They are nematodes, cystodes and trematodes. I explained to you these are classified according to their structure and morphology. So nematodes are roundworms with smooth cylindrical bodies. Nematode shapes are round in structure with smooth cylindrical bodies. Cystodes are tapeworms which are flat segmented ribbon-like, tape-like and they lack guts. Trematodes are flukes. Flukes, we all are aware flukes are leaf-shaped flat worms and also they were having suckers. Then we can see some pathogenic helminths coming under each category. So under nematodes, Enterobius, Ascaris, Ankylostoma, Strongyloids, Trichuris, Trichinella and Microfilaria. These are important pathogenic helminths coming under nematodes. These all are very big names and it's very difficult to understand or easily memorize. So I made some mnemonic to remember easily. See. Use the term E-stem. It defines E for Enterobius, A for Ascaris, A for Ankylostoma, S for Strongyloids and so on. So the pathogenic helminths coming under cystode, third, Tinea, H. nana, H. diminuta, Echinococcus, Diphylidum caninum, Diphyllobothrium latum. Then trematodes. I think it's easy to remember all flukes coming under trematodes. Flukes are Fasciola busci, Paragonimus, Clonorchis and Schistosomes. So like this you can also make some mnemonic for easy to remember. So now we all are aware what are helminths. They are multicellular parasite worms that infect humans. Now we all are aware of helminths. They are multicellular parasitic worms. They infect humans and cause helminthiasis. What are the signs and symptoms of helminthiasis? Most of the infections are common in areas with poor sanitization and hygiene. You know where there is poor sanitization and hygiene? Of course, there will be parasitic infection because as we all are aware, the transmission occurs through contaminated food, water, soil. So come to our points. What are the signs and symptoms of helminthiasis? The major symptoms almost similar to other gastric problems. The gastric problems are common for all human beings. We all are facing these issues like diarrhea, abdominal pain, gas and gastric problems, bloating, nausea and vomiting. So most of the time the treatment will get delayed because we will confuse. There are some key indicators of a possible helminthic infection. These are not specific diagnostic tests. These are possibilities. Maybe it's a helminthiasis. What are they? Elevated IgE and eosinophil count. In most of the parasitic infection, the IgE and eosinophil counts will elevate. So we can assume maybe there is possibility of helminthic infection. How we will confirm it? Increased IgE and increased eosinophil count is not the final diagnosis. It's a possibility. It can prompt further more specific investigation to identify the exact parasite. parasite. See this picture? It's colorful, looks like an apple. But observe this, it's a helminths. It releasing antigens. These antigens stimulates Th2 helper T cells, and these T cells releases cytokines and cause increase in IgE and eosinophil, and thus in parasitic infection there will be an elevated IgE and eosinophil count occurs. Now we can move to our images. See the picture. This is a picture of Ascaris egg. There are two types of eggs, fertilized and infertile. This is fertilized egg. From the picture itself, you can understand what is the difference between fertilized and infertile or decorticated eggs. Its color is clear to yellow brown, may be fertilized or infertile egg. We can see under microscopy. Fertilized eggs are round to oval. They are thick shelled. Round to oval and thick shelled. Keep in your memory, fertilized eggs of Ascaris lumbricoides are round to oval, thick shelled, but infertile eggs when compared to fertile is elongated and thin walled. Eggshell is bumpy. Ascaris species are very large in size. Females are approximately 20 to 35 centimeter and males 15 to 30 centimeters. Who is this? This is Enterobius vermicularis. Enterobius vermicularis is widely known as the human pinworm. Why? Why it's termed as human pinworm? Due to the female's long pointed tail. See the curved pointed tail. Also it has an esophagus divided into muscular and bulbous portion. How we are distinguishing Enterobius vermicularis? Its pin-like curved tail, also the structure of esophagus. It is divided into muscular and bulbous portions and separated by a short, narrow isthmus. Posterior end of the worm is with a blunt end. So you understood the image of Enterobius vermicularis worm, how it will be. It has a pointed curve and a blunt opposite blunt end and its esophagus. This is the peculiar characters. Then when comes to the egg, the structure of egg looks like a D. One end of the egg is like plain in shape and the other end is curved. So the eggs are colorless, moderately thick-shelled, ovoid with a flattened side and opposite curved side. It looks like a D shape. Then please understand that a fully mature adult female measures 8 to 13 mm only in size, and adult male are 2 to 5 millimeter. Males are smaller than female. The adult lifespan is about 2 months. Strongyloids stercoralis, this is an important helminths. It's a parasitic roundworm that infects human. It can cause stomachache, diarrhea, vomiting, rashes, as we discussed earlier. Most people have no symptoms, but people with immune disorders, that is immunocompromised people affecting severely. Most people have no symptoms, but the people with immune disorders or taking drugs affecting immunity can get severely ill. The important points we have to memorize about strongyloids are: infective form of this larvae is filariform. There are two kinds of larvae, rhabditiform larvae and filariform larvae. The infective form of strongyloids are filariform larvae. Immunocompromised patients are affecting more. Autoinfections. Some of the rhabditiform larvae develop in the bowel and reinfect the host. Please memorize these points. Infective form of strongyloids are filariform larvae. Autoinfection, like some of the rhabditiform larvae, develop in the bowel and reinfect the host. Infection more in immunocompromised patients. Now come to hookworm. Hookworm, it's easy. See the picture. Ankylostoma duodenale and Nectar americanus are important worms. They are considered to two primary intestinal hookworm species worldwide. The egg morphology is very typical. See, with the rounded ends. Both ends are rounded. See here, there are blastomeres. A clear space between the eggshell and the developing embryo. See the clear space. This is developing embryo. This is the eggshell. In between the embryo and the cell wall, there is a clear space. Same like Ascaris filariform larvae that are infective forms. It's around 500 to 700 micrometer long. Yes. Come to other important point of ankylostoma. See these pictures. It looks like a wood. No, it's teeth. It's teeth of Ankylostoma duodenale and Nectar americanus. In an adult Ankylostoma duodenale, anterior end showing cutting teeth. There are two pairs of cutting teeth for Ankylostoma duodenale and a pair of cutting plate for Nectar americanus. These are cutting plates. See, a pair of semilunar cutting plates for Nectar americanus and two pairs of distinct curved teeth for Ankylostoma duodenale. Ankylostoma duodenale. Please memorize these morphological differences are key features to differentiate between Ankylostoma and Nectar americanus. These teeth or plates they are using for attaching to the small intestinal wall and sucking blood from the host. Oh, whipworm. See, whip-like structure. Whipworm. Trichuris trichura. It's an adult whipworm. See, this is an adult whipworm. It looks like a whip. The head end. This is the head end. The head end thin section or whip portion embeds itself in the intestinal. Here, this is the mucosa. Thick end. This is the handle end is free in the lumen. This is the egg. See this image. Note the two polar plaques on at each end. This is mucus plaque. Polar plaques you can see the mucus plaques. Also the structure, the shape, it's a barrel shape, ovoid to barrel shape with mucus plaques at both ends. Now come to Diphyllobothrium latum, broad fish tapeworm. It's fish tapeworm. It's a cestode tapeworm. It may be, the egg may be confused with the fasciola since they are also operculated. Fasciola also operculated. See here you can see operculum, but the operculum is without shoulders. There is no opercular shoulders for Diphyllobothrium latum. Come to the opposite side. There is an abopercular bump at the opposite end of the egg. So you should remember, if you are finding a Diphyllobothrium latum egg in your microscopy, you should measure the size because this measurement is easy to distinguish with fasciola. Here you can see three proglottids of Diphyllobothrium latum. Here see the centrally placed structure. This is the reproductive structure. The adult tapeworm can be as long as 30 feet in size and large sections of the worm can be passed in the fecal specimen. Taenia. It's very cute egg. Taenia solium or Taenia saginata. It is very difficult to distinguish between each other. Eggs are brownish yellow, round to oval and have a thick shell with prominent radial striations. See the striations. It's round to oval, has a thick shell. We cannot easily distinguish between Taenia saginata and Taenia solium. We required special stains to distinguish these two eggs. See, if we are finding Taenia eggs in our microscopy, how we can report this? We can report as Taenia species egg seen, unable to identify to the species level without special testing. If you have special stains to distinguish, you can and report species wise. Adult can reach a length of 2 to 8 meters. I think you memorized the visual of Taenia species. This is the adult tapeworm. It measures 2 to 8 meters. See, it measures 2 to 8 meters. Tapeworm. It is ribbon-like or tape-like and measures around 2 to 8 meters. Taenia solium can cause cysticercosis. Please remember, cysticercosis causing worm, Taenia solium. See this picture. See the colorful picture. What is it? It is proglottid of Taenia. Taenia saginata and Taenia solium proglottids. What is the difference between Taenia saginata and Taenia solium proglottids? Taenia saginata and Taenia solium differ in their uterine branches. There are lateral uterine branches for gravid proglottids. For Taenia solium, there are 7 to 13 lateral branches, but in Taenia saginata, 12 to 13 lateral branches. 7 to 13 for Taenia solium and for Taenia saginata 12 to 30. From the picture itself you can understand. See the branches, it's more in Taenia saginata. This is Taenia saginata. It's more in uterine, lateral uterine branches are more in Taenia saginata when compared to Taenia solium. Taenia solium is having 7 to 13 branches and Taenia saginata is having 12 to 30 branches. Okay, then same Taenia, it has some other differences also. The morphological differences of Taenia solium worms. See the scolex of Taenia solium and Taenia saginata. This is Taenia solium scolex. Taenia solium or pork tapeworm scolex. Note the four suckers. It is not easily visible in this picture. See the picture. 1, 2, 3, 4. Note the four suckers and scolex. They have four large, for Taenia solium have large four suckers and rostrum containing 2 rows of hooks. But when we are coming to Taenia saginata or beef tapeworm, note the four suckers without hooklets. There is no hooklets, but there are 4. This is the difference between scolex of Taenia solium and Taenia saginata. Taenia solium suckers. It has 4 suckers and presence of hooklets. And in Taenia saginata, note the 4 large suckers and lack of rostrum and rostellar hooks. H. nana. Hymenolepis nana or diminuta. These are 2 species of Hymenolepis. Hymenolepiasis is caused by these cestode worms. Hymenolepis nana, it's dwarf tapeworm. And Hymenolepis diminuta, it's rat tapeworm. There are morphological difference to distinguish these 2 eggs. Hymenolepis nana, H. nana is mostly we are finding in humans, and H. diminuta very rarely we are finding in humans. It's a cestode of rodents. See the egg size. H. nana is smaller than H. diminuta. Also, H. diminuta has thick outer membrane when compared to H. nana. Here you can see the oncosphere. Both has oncospheres. You can see the oncosphere. There will be 6 hooks. The oncosphere has 6 hooks. Now we are moving to flukes. This is Fasciola hepatica. Eggs are among the largest seen in humans, measuring 120 to 150 micrometer into 80 to 85 micrometer in size. They are yellow-brown, ovoid, thin-shelled and have a small operculum. You can see the operculum. Eggs are big in size. There will be an operculum. Fasciola hepatica has a global distribution, especially regions where sheep and cattle is present. Infections are often seen in individuals who eat raw water plants containing infective metacercaria. Metacercaria is the infective form of Fasciola. Then there is an important point. Fasciola hepatica, it can be difficult to distinguish from Fasciola busci eggs. So how we will report? If you are finding Fasciola eggs in your microscopy, you should report it as Fasciola or Fasciolopsis because due to morphologic overlap. This is Paragonymous westermani or lung fluke. Eggs are yellow-brown, ovoid, moderately thick-shelled, measures 80 to 120 into 45 to 70 micrometer in size. They have shouldered operculum. See the operculum. We can distinguish there is a shoulder for this operculum. And the opposite side is thickened. Here it's thickened. Infection is usually seen in people who are eating undercooked crustaceans. Adult organism lives in the lung causing cough and bloody sputum. This Paragonymous westermani geographically distributed in Japan, Korea and China. Okay, move to Clonorchis sinensis. It's a trematode fluke. This is an important foodborne pathogen and cause of liver disease in Asia. This appears to be only species in the genus involved in human infection, Clonorchis sinensis. It is the only one species which cause human infection. For Clonorchis also you can distinguish the opercular shoulders. Opposite side there is an abopercular end. You can see the knob here. These eggs are the smallest within the trematode group. Clonorchis eggs are the smallest within the trematode group of human parasites. Come to Schistosoma hematobium. It's a blood fluke. This is Schistosoma hematobium and this is Schistosoma mansoni. From the picture itself you can distinguish each other. It's an important question for examinations. Note the presence of miracidian larva within the eggshell and the large terminal spine. See the terminal spine of hematobium. Schistosoma hematobium, it has large terminal spine. But in Schistosoma Hansoni, there is large lateral spine. Also, it has miracidian larva within the eggshell. The Schistosoma infections includes hematuria and hydronephrosis because these adult worms are found in the venous plexus around the urinary bladder and they release egg to the wall of the urinary bladder. When they are residing near the urinary bladder, they will use the host as its food. So, of course, there will be infection and the possibility of hematuria is more. Then the eggs which they released travel to the wall of the urinary bladder, causing hematuria and fibrosis of the bladder. The bladder becomes calcified and there is increased pressure on ureters and kidneys. Of course, whenever there is infection occurring in our bladder, it will give a pressure to ureters and kidneys. This condition is termed as hydronephrosis. Okay, this is the time to wind up our section. What message you got today? Most of the people get intestinal parasites when they consume parasitic eggs through contaminated food, water or soil or from insect vectors. After all, most of us like to think we are in complete control of what goes in our mouth. But this thinking does not apply when it comes to parasite eggs. It's very impossible to see with the naked eye, and if you have gotten eggs on your fingertips, you can spread them absent-mindedly when you touch objects, food and yes, even in your mouth. So, what message you can keep in your mind after this section? Awareness is important. Yes, understanding how intestinal parasites spread can make you think twice before skipping hand washing techniques. WHO approved hand washing techniques you can follow. If you do get infected, don't delay seeing a healthcare provider. They will provide antiparasitic medications. It can evict your unwelcome guests before they settle in and make health issues. Today's our question is, which parasite cause auto-infection in immunocompromised patients? Which parasite can cause auto-infection in immunocompromised patients? We already discussed it's strongyloids. See this image. What is it? It's a whipworm. I think this tutorial can help you to understand some pathogenic helminths and at least you can score 2 points for your competitive exam also. Thank you for watching. Don't forget to like, share and subscribe.